Good morning, sirs and mads. I want to thank the leadership of the HLD LASUTH for the great opportunity to present here, and also the leadership of the Academic Research Committee for this great opportunity. My name is Dr. Oluwaseun Ajadi. I am a resident doctor in the Department of Community Medicine and Primary Care in Federal Medical Center, Abeokuta, and I'm the representative for NSOS Health this morning. NSOS Health is a telemedicine company in which we are licensed to practice as an healthcare company in Nigeria, and who we are and what do we have to offer. Our mission is to improve health outcomes by facilitating timely, efficient interactions between users, health practitioners, and providers by leveraging on artificial intelligence for intelligent health actions. And our vision is to be at the forefront of healthcare innovation, making proactive and hand-to-hand and AI-driven health management accessible to all. So in Enhances Health, we designed a platform called Rozlyn. So Rozlyn is an artificial intelligence-driven platform that connects users with accredited and healthcare providers worldwide with the aim of making healthcare accessible and efficient to everyone. We found out that there are some challenges in the Nigerian healthcare system, and then we designed Rozlyn to actually be a solution to this problem. The first being long waiting time. All right, can you please go back to the other side? Long waiting time. Long waiting time, we notice that there's long waiting time in the Nigerian healthcare sector, and the major factor is due to the insufficient doctors, insufficient healthcare practitioners. From different studies, we're able to understand that the average waiting time is about 4 hours, and this is actually too long. So with this, we designed Rozlyn such that doctors, wherever they are, they can actually consult with patient can book appointment with doctors anytime, because we found out that the doctor to patient ratio, according to the WHO, is 1 to 600, but in our country, it's worse. We have about 1 to 10,000 doctor to patient ratio. So, but with this, we're able to provide a solution with Rozlyn. Another problem is the ineffective and poorly organized hospital appointment systems, which is actually seen in our public hospitals. And this contributes to the long waiting times and also to overcrowded clinics. So Rozlyn is actually a solution to also this problem that we actually found out too. So another problem is the fragmented health records. We notice that in our healthcare system, there are situations where the patient's health information is scattered across different hospitals, different clinics, different departments, and then they use paper files. But with Rozlyn, we are able to actually have a centralized record for our health, for our patients, so that their patients, their history, what they've been managed so far is centralized. And this will make the patient have a complete medical issue when it is needed and it is easily accessible. And with this, we have a continuity of care. Another problem we found out is in Nigeria healthcare, it is predominantly reactive. Reactive in the sense that patients only come to the clinic when their conditions get worse. But with Rozlyn, with my interaction with patients in clinic, and when I tend to ask them that why does you have to get, that this thing doesn't just happen within the time you came to the hospital. This must have been having the symptoms, but they tend to complain that by the time they come to the hospital, they have long waiting time before they can receive care, and then they have places of work that they have to be. But with Rozlyn, you can actually at any time a patient notices any symptom, you can actually book an appointment with the medical practitioner on our platform. And with this, the patient can proactively maintain health. Another challenge in our healthcare system in Nigeria is disrupted continuity of care. Because the patient's health information are not really centralized, in cases where the patients will have to travel out of the locality of where he or she is receiving care, and there's no continuity of care. But with Rozlyn, the platform is actually designed in such a way that the patient's history, the treatment history, the allergies, the Everything that we need to know about the patient has been centralized, that it follows the patient wherever they go. So any doctor that is assessing, that wants to see the patient, can actually have access to the medical record of the patient. So why Rozlyn? Why do we have to use Rozlyn? Because there are different telemedicine platforms. But why are we saying that you should onboard as a medical professional on Rozlyn? So there are different benefits to Rozlyn. And with the first is efficient scheduling. With Rozlyn, there is a structured and organized patient-centered approach in managing appointments. Another benefit to Rozlyn is the unified patient data. With Rozlyn, the entire patient's medical history is stored in a centralized and secure digital platform. And with this, the healthcare providers can actually seek access to know about the patient and also to get the patient history with the permission of the patient. We are key on data privacy in NCS Health with our Rozlyn products. So before a doctor can assess a patient's medical history, the patient will have to grant access to the medical doctor. So another benefit is the AI-driven insight. As I said earlier, Rozlyn is an artificial intelligence-driven platform. So with this, our artificial intelligence algorithm provides the clinical decision support and personalized recommendations to healthcare practitioners in the management of their patients. Also, another benefit of using Rozlyn is the mobile access. We offer video consultation services with our website, with our mobile app. We have our mobile app on Google Play Store, Rozlyn, where patients can actually book appointments with doctors and also seek care. And also, another benefit is the telemedicine support. Rozlyn provides an infrastructure such that it enables effective remote delivery of healthcare system. And also another benefit to Rozlyn is the charge per consultation. So we've designed Rozlyn in such a way that every doctor has an opportunity to actually set their consultation fee. We believe that every doctor know the worth of their time. So they understand how much it is that they can charge for consultation. It's not restricted in any way. And then at the end of every consultation, the doctor gets paid. And this is another extra means of income, another extra source of income for medical doctors, so that we can consult with patients remotely at any time at your own convenience, and then you can also make money at that. Another benefit is the increased visibility. With Rozlyn, you can actually manage patients outside of your locality. It can be even outside of Nigeria, your patient that have traveled out of the country and you've lost care, you've lost the continuity of care with such patients. You can actually still continue managing such patients from wherever you are. So there's an increased visibility for medical doctors such that they become more noticeable, they become more accessible, they are more recognized by the people that need them to be engaged. Another benefit to Rozlyn is the research opportunities. There are research opportunities that comes with being a doctor on Rozlyn, on Rozlyn, because we are centered on, our company is centered on research. So we foster collaborations for research purposes. So any doctor that wants to go for research, and so the Rozlyn can be a source of data with the consent of the patient. And then what makes us unique, what makes us important, because our platform is just a telemedicine platform. We also have our wearable applications, such that if it can monitor the vital signs of patients, it can monitor their blood pressure, their pulse rate, their ECG, such that if at any time their signs are off the charts, the patients can be alerted. So our application is going to alert the patient that, okay, you need to book an appointment. And we'll also go ahead to book an appointment with the patient's practitioner. So the practitioner will also get an alert that, okay, there's something wrong with your patient, and then go ahead with the consultation. So with this, we'll be able to actually break the barrier of the reactive care, because even at the earliest sign, at the earliest symptom, the patient can actually seek care and do not have to wait till when the conditions are worse. So, and what do you need to onboard as a medical practitioner in Rozlyn? You need your medical and dental certificates of Nigeria registration certificates. So we need your annual practicing license. Not just and in cases, I understand that okay, to get another particular the practicing license might take a while before the NDCN can send it. So the receipt can also be used to actually onboard, and then you have the profile picture. So we designed Rozlyn such that it is so easy that anyone can actually find their way through to onboard, to get themselves on board on the platform. So we want you to join us today and to visit our website, which is www.nshealth.ng, or you can also scan this barcode so that you can actually onboard. It's a very easy way of onboarding. And I want to conclude by saying that actually, as medical practitioners, at different points in our life, we would have actually done a form of remote consultation indirectly. There'll be families and friends that I would have reached out to you one way or the other and asked that, doctor, I have this complaint, and then what can I do? And then most times we actually don't charge. But while we are doing what we love, while we are actually saving lives, while we are helping patients, why not do that in a structured platform whereby as you are doing what you love, you are also earning alongside. So we'd love you to join us today to onboard on Rozlyn, and you can get patients. Your visibility is increased the more you use the platform, and then the rating you get from every consultation. So thank you very much.